And as far as partnership is concerned, Malaya, the board, deals with various sectors, government, as you can see, government, NGOs, corporate sectors, religious groups, international organizations, Institute of Higher Learning, the media, state authorities, religious groups, and international organizations. So really, these are all the state players taking part in the health promotion activities. And here what we do have is looking at the strategic partnership. We have the activities and we have the outcome variables as well. And basically, the main activity would be capacity building, networking, building relationship, and further support. And at the end of the day, what we hope to see in all these strategic partnership is the empowerment of the community, participation in the health promotion program, and mobilization of the various population and community as well. And finally, of course, the sustainability of the various health promotion program. And what we see here is My Sehat NCD Community Intervention Program. We have all sorts of health promotion programs carried out by the Ministry of Health and as well as the My Sehat board, such as Smoke-Free Initiative, the Blue Ribbon Campaign, and these are all to tackle the non-communicable diseases. And further on, we have, for instance, the Smoke-Free Initiative. We have the Smoke-Free Cities, Smoke-Free Heritage Site, and Smoke-Free in religious premises, and also tobacco-free universities. And so these are some of the campaigns that are actually carried out under the Malaya health promotion programs. And the other program that is under other activities that's under the health promotion program, it's what we call the Blue Ribbon Campaign. And this is to recognize and honor significant roles contributed by people and organizations who save people's lives from secondhand smoke by advocating 100% smoke-free environment. So these are some of the incentives given to organizations or individual people who helped to advocate smoke-free environment. Now, the Smoke-Free Initiative Partnership, they have partnership with multidisciplinary agencies and various sectors, such as the state government, intergovernment agencies, various NGOs involved as well, universities, corporate sectors, the private sectors, tobacco alliances, local and international alliances. And as far as smoke-free religious promises, such as in the mosques that we have, the churches, the Buddhist temples, and the Hindu temples. And so this is where we advocate smoke-free in all these religious buildings. Now, the government partnerships as well within the government itself, for example, working together with the Ministry of Youth and Sports in terms of healthy exercise, and Ministry of Information, Communication and Culture. This is via the media approaches, and of course through the Ministry of Education, where we have the health promoting schools. Moving on, we also have the partnership with NGOs, and here these are the open grants that the Malaya actually gives to the NGOs for them to implement the health promotion and health promotion projects, others such as sports and recreation, dealing with culture, building capacity, and also research. Now, there are also partnerships with, for instance, the Malaysian Olympic Councils, that is via sports, and we have Sports for All, which helps promoting health through sports activity and practiced by all categories of the population without any distinction. We also have partnership under the Malaya working together very closely with the private sectors, for instance, IBM, the Malacca, the Heritage, strategic plan, smoke-free, such as the Sunway City, and the healthy lifestyle malls, the shopping malls. And of course, we also have in the workplace as well, the health promoting place, such as the Sunway centers. And we also have partnership with the media. These are some of the media, for instance, in our local dailies. One of the Malay dailies, Berita Harian, advertising the 10,000 steps. The other is Sun Kaya, the publication of the Healthy Lifestyle magazines, and the Malaysian Press Institute collaborating with prominent media related NGOs. The MySehat also work very closely with universities, and such as the Tobacco Free University, and also we have the Health Promotion Ambassador. That is, we work very closely with the university students and selecting people, students as health promotion ambassadors. And of course, they carry out research as well pertaining to health promotion. Just to quickly walk through with you this the healthy lifestyle campaign under the MySehat board, and it started in 1991. We have several phases to see through. So the phase one, they have various teams: cardiovascular diseases, STI, cancer, food safety, child health, and diabetes. Following on in phase two, that is from 1997 onwards, we have the healthy eating, exercise, physical activity, safety and injury prevention, healthy health, healthy family, and healthy environment. And subsequently in 2003, that's under the phase 3, increased physical activity, health eating, coping with stress, and non-smoking as well. And so, of course, right now it's mainly the sustainability of all these health promoting programs. This is just to illustrate an example of the health promotion program carried out. This is actually last year, where we celebrated the Malaysian Independence Day. And this is between all the government and NGOs in promoting a healthy lifestyle. So you can see here, this is the Mama Care under the LPPCAN, the National Population and Family Planning Unit, where they take care of the woman's health. And of course, we have a campaign dealing with drugs, anti-drugs use as well. And of course, no smoking. And we have, this is the marathon run held during the Malaysian Independence Day celebration. Now, what are the challenges that the MySehat board actually face? It's a new technology in this day and age with the digital area. I think now in terms of advocating health promotion activities, I think new strategies using latest technology is warranted. And more community engagement. Here we would like to engage more community, the population out there, to further improve things like physical activity in the community. And of course, bigger investment in terms of human resource and finance as well, in order to run successful health promotion program. And sustainable financing and good governance, taking into consideration the evaluation of these programs as well. Now, developing partnership requires the following. We do need to have leadership, leaders who are able to come up with programs and to be able to see the vision of where all these health promotion programs are actually leading. And to continuously learn and to improve oneself, and of course the trust as well, and managing for performance. And so all this open communication and trust are all very essential ingredients for partnership working, and they are very dependent on good networks for sharing information and establishing common values and goals. And of course, partners can be drawn from different professional backgrounds, from different cultures, from society, and different discipline. So really a multidisciplinary partnership, it's vital. And also the management of diversity, it's actually integral to any success of the health promotion program. And of course, should there be any conflict which pose as a barrier to joint decision making, all this should be worked out immediately, especially when it involves an imbalance of power. So successful partnership really demands time and commitment, and also a very supportive organizational structure and appropriate skills among all those who are involved in health promotion.